about Dr. Krishna. Once accused of, by this same lobby of vaccine nationalism, he's today a global superstar, the man behind COVAXIN. Here's a clip of my interview with him, which will run this week. Ladies and gentlemen, in about a week's time, India will be rolling out the next phase of what is indisputably the biggest vaccination drive in the world. And our idea is to vaccinate every adult in the country. Everyone who's medically eligible to get the vaccine will be getting the vaccine. And while there are many people who've contributed to making this possible, and of course, there's been the leadership and vision of the Prime Minister in this, one person who I think the nation must be grateful for is the person joining me on this episode of The Nation Wants to Know. Dr. Krishna is the chairman and managing director of the incredible company called Bharat Biotech International Limited. He leads the team that has created COVAXIN, and COVAXIN is India's self-made vaccine against COVID, highly reputed. It's got all kinds of international scientific and medical credentials. All across the world, it's being celebrated, and we're hearing more and more about it. Before I begin, let me say this, that it's not been an easy ride for Dr. Krishna. We'd love to know about his entrepreneurship, but even in his battle to get COVAXIN to every home and to everyone who's eligible, he's had to face many odds. Viewers, you would remember that 3 to 4 months back, there were a lot of cynics who were on a daily basis running down COVAXIN. Some people said this is India's vaccine nationalism. Dr. Krishna has taken it all on the chin. And today, he's been proven absolutely correct. And that's why it's a great honor to speak to you, Dr. Ella. It's a great pleasure. Thank you for joining me on this episode of The Nation Wants to Know. Thank you so much.
Thank you, sir.
So, tell me, Dr. Ella, to start with, what's this journey been like? Tell me about the last 1 year or a little more since COVID hit the world. What's your journey been like?
I mean, when COVID hit, I think I really pity for a lot of people losing a job, migration of the workers from one state to another state. These are all pain me, actually. See, the economy affects mostly the poorest of poor people first, not the rich people much, but the poor people are the most affected. And at that, I feel very bad about it. And then, for us as a company, manufacturing in such a, lockdown issues was also challenging issues. But this is a part of the life. Everybody has to face it. And we looked at it as a challenging stage that, the country gives an opportunity, or the world, public health gives you an opportunity to help the society at large. If anything we can do as a scientist, that's all what we look at as a scientist. Not as a businessman, as a scientist, what I look at it, anything I can do as a scientist to the society. That's all the important. Not business, balance sheets are not important for us.
Absolutely. When did you start on this journey of trying to find a vaccine, a cure for COVID? When did you start on this journey? Did you have any head start?
I think, Arnab, when in 94, when P.V. Narasimha Rao came to UN agencies in New York, I was also invited in US when I was in US. And when all the pharma companies, American pharma companies were there, they were only asking two things to the Prime Minister that time. One was, why is the Indian pharma companies are copying the drugs? Number one. Number two, they were insisting in data exclusivity. That means whatever the clinical trial they've done, they want to have exclusivity. Somebody should not copy the clinical trial data by other. The two things really hit me a little hard when in that meeting in New York. I said, India cannot be anymore copying the drugs. We should innovate. That is my dream right from the beginning. When I came to India, that's how I named the call Bharat Biotech. I want India to get that innovation. And I want sincerely feel the next generation of this country has to stay back in this country. And that opportunity can come not by government cannot give all those things, but every entrepreneur can create something which can be a spin-off for others, a role model for others, or we fight the system, clear a lot of barriers, and so the next generation people will prosper. That's my dream right from the beginning as an entrepreneur. And the second point is, you can ask me, how did you get entrepreneurship? I am from a farming family from Tamil Nadu. I looked at my mother and father. They are the best entrepreneurs. They don't have any money. They borrow the loan. They borrow 100 rupees and they put the crops. If they don't get 100 rupees, 150 rupees, that means they're profitable 50 rupees. If not, if it goes to 90 rupees, they lose the money. They don't have a chartered accountant to balance sheet and all that. But it's a simple arithmetic. Farmers are the best entrepreneurs in the world. And they know how to take a risk that still can survive in such a worst scenario. I looked at my father and mother, and that was all sort of inspiration. I said, my father can take that type of risk in my life. Why not I do it?
That's amazing. That's amazing. And you set up Bharat Biotech. You must have had a vision. My question was more in the context of COVID. I'll come back to Bharat Biotech in just a while. My question was in the context of COVID. Everyone, our viewers will be very curious to know, Dr. Ella, how did you find this particular, the what would you call it? The formulation or the combination or to fight COVID? How did you come up with COVAXIN? Did you have a head start? I was asking you, did you have a head start like when you started? Were you already working on something like this when COVID hit the world? Or did you start after COVID hit the world?
Arnab, two things important for us. It's one more virus for us. It's not something, one more virus for me as a scientist. It's one more virus. But I'll give you an example of rotavirus story that is isolated from All India Institute of Medical Science by Dr. Ban. And it took 17 years, the product came into the market right now, saving a lot of children on diarrheal diseases in the country. So we have total expertise on that. And another second is typhoid conjugate, first vaccine in the world. Even multinationals doesn't have, even US and Europe doesn't have that vaccine. We were the first company in the world to develop typhoid conjugate vaccine. Now we are supplying to many countries in poor countries like Pakistan, Zimbabwe, Malawi, Ghana, all these countries. So we have a history of understanding a disease problem and how to solve the problem with using that expertise. And then rabies, inactivated vaccine. So this is also COVID. We thought we'll also make inactivated vaccine. And fortunately, what happened, we had a BSL-3 facility, which we created for the injectable polio vaccine plan. And that came in right in handy. So we said, okay, we'll get the COVID. Then how do you get a strain? That's how I wrote the letter to ICMR Director General Balram Bhargav and NIV Pune Director Priya Abraham. And both positively reacted quickly. And then we got the virus strain. And is another story, just another vaccine production for us. Another one more.
No, once you got the virus strain, you're making it look so easy. Just explain the detail a little bit. Once you got the virus strain, what happens after that?
Once virus strain comes, we multiply the virus, and we make a small tubes we call master virus bank. From master virus bank, we make a working virus bank. The working virus bank is the one which is used for production. Master virus bank is stored for next 40 years, 50 years with the company. And the working virus bank, we take it one while and grow the cells, viro cell culture in the fermenter, add this virus to that, infect them, and then do the downstream process purification. You make pure virus, inactivate them with a chemically, so that when you have chemical use, that RNA which are there in the virus get knocked off. So now it's like exactly looking like a virus, but it cannot replicate. That's all the difference is. You make inactivated, similar structure, same conformation, and it look like a virus particle. So when you give injection, what happens is body thinks a virus has come, but that virus cannot multiply because we knocked off the RNA. Because RNA is knocked off, so body feels this virus has come, it start producing immune response to that. And what we need as a challenging for us, particularly these sort of problematic virus like injectable polio and all this problem, we know that it needs more of a T cell response, and basically called CD4 or alternatively cell-mediated response. That's a very critical for this virus. Not that IgG, immune response, which is important for other viruses, but not for this. So we looked at that. That's how we licensed one adjuvant from US, from NIH, a Virovax company from US. We licensed that one. We started manufacturing that adjuvant combined with this one so that we shift from IgG to T cell response.
But how long did it take you to develop the COVAXIN prototype? Specifically this one. How long did it take?
Pilot scale production, we finished in 2 months.
I'm looking at the headlines, and this by January. By the way, how good are you at responding to what happens in the media? Because I think what you were doing was a great job, and you were doing national service, but then everyone started attacking you. Not you as in personally, but started attacking Bharat Biotech.
I think, I pity those people, because I don't know whether they want their children to stay back in India or not. I don't know that. Okay, honestly, I feel pity for them, because they need to at least some encourage. I don't want any prize, but at least not to talk bad about us. They have a skepticism about Indian innovation. They have a skepticism about Indian
I also think so. I think so. I think there are a group of people in India, if there's a foreign label on anything, they will accept it, even if it is third grade. But if it is Indian, even if it's first grade, they will run it down. I genuinely think so. And that's the problem in our country. I saw this and it made me angry at that time. January 4th, a journalist called Andy Mukherjee puts out an article on Bloomberg Opinion and says, India's vaccine nationalism is a global risk. And then went on to say, in Bloomberg Opinion, this person called Andy Mukherjee said, the country has approved a domestically developed jab that does not yet have a critical phase 3 data. So basically, COVAXIN was run down. It was an attempt was made to give an impression that it was technologically backward, that it ran a huge risk. And that narrative may have changed now, Dr. Hirella. But let me take you back to early January, when COVAXIN was granted emergency approval. You were basically projected as somebody who was working with the government to get your clearances done fast, to make money, and risk the lives of millions of Indians. This was the narrative that was created. I want to know how you dealt with that at that point of time and what impact this had on so many of your colleagues at Bharat Biotech.
It was demoralizing for us at that time. When you were just mentioning some press person, they should look at it. One Indian company, a small company, biotech company in India, everything manufacturing and clinical trial, everything done by that company. You look at US, Pfizer and Moderna, NIH has done all the clinical trial. And US's government funded the clinical trial, NIH has done all the clinical trial. You look at AstraZeneca vaccine, entire Oxford developed it, Oxford done all the clinical trial, whether Brazil, South Africa trial or UK trial. Whereas me, as a small company, Bharat Biotech, I've done everything manufacturing, all the clinical trial done by company itself in India. I think press people should recognize that difference between one Indian company doing everything on their own compared to a multinational, which is with all the government funding and all the government help of a clinical trial. Okay, that type of scale up operation is given to us. I think we can do phenomenally globally, actually. But I think this public-private partnership teaches that game for the future. But I think, I'm not, let them criticize because they can't believe that India can do it. And they have a perception, but they don't think that the new generation people like us are entering into the field. We can also change the game in the country. They don't want to believe that. They want to compare us with the old generation entrepreneurs of the country. I think that mindset has to change in the press, that India can do it. And they should encourage a lot of young generation people in this country, not talk nationalism. They're talking about nationalism. I'm not talking about nationalism. We are talking about global public health. We don't talk about nationalism. What is important is when I go to another country, they create a nationalism. Okay, well, let us stop Indian vaccine. Let's look at the other vaccine. There comes a nationalism, not us. India never do that. And we, as entrepreneurs, we don't create that type of nationalism at all. We look at it as a public health, global public health. For example, Arnab, we supply 35 million doses of typhoid conjugate to Pakistan to save the children in Karachi area. Because the children are dying in Pakistan, not responding to any antibiotic to the children, to the typhoid. They've all become multi-drug resistant to typhoid. And we are saving the children there. I mean, if I have a nationalism, then I should not be supplying. And I don't have that. I supply to Malawi, I supply to Zimbabwe, I supply to Myanmar, I supply to every country. For me, every child is a global citizen for us.